Pelvic inflammatory disease, PID, CDC fact sheet. Different languages. Untreated explicitly communicated infections, STDs, can cause pelvic provocative sickness, PID, a genuine condition, in ladies. 1 out of 8 ladies with a background marked by PID experience challenges getting pregnant. You can forestall PID in the event that you realize how to secure yourself. Fundamental fact sheets. Fundamental truth sheets are introduced in plain language for people with general inquiries regarding explicitly sent infections. The substance here can be partnered. What is PID? Pelvic incendiary sickness is a contamination of a lady's conceptive organs. It is a complexity regularly brought about by certain STDs, similar to chlamydia and gonorrhea. Different contaminations that are not explicitly sent can likewise cause PID. How would I get PID? You are bound to get PID on the off chance that you have an STD and don't get treated. Have more than one sex accomplice. Have a sex accomplice who has intercourse accomplices other than you. Have had PID previously. Are explicitly dynamic and are age 25 or more youthful. Douche. Utilize an intrauterine gadget, IUD, for conception prevention. In any case, the little expanded danger is for the most part restricted to the initial 3 weeks after the IUD is put inside the uterus by a specialist. How might I diminish my danger of getting PID? The best way to stay away from STDs is to not have vaginal, butt-centric, or oral sex. On the off chance that you are explicitly dynamic, you can do the accompanying things to bring down your odds of getting PID. Being in a drawn-out commonly monogamous relationship with an accomplice who has been tried and has negative STD test results. Utilizing latex condoms the correct way every time you have intercourse. How can I say whether I have PID? There are no tests for PID. An analysis is typically founded on a blend of your clinical history, actual test, and other test outcomes. You may not understand you have PID in light of the fact that your indications might be gentle, or you may not experience any side effects. Nonetheless, in the event that you do have manifestations, you may take note. Agony in your lower midsection. Fever. An uncommon release with a terrible smell from your vagina. Agony as well as draining when you engage in sexual relations. Consuming sensation when you pee, or seeping between periods. You ought to be analyzed by your PCP in the event that you notice any of these manifestations. Immediately see a specialist on the off chance that you think you or your sex partners have or were presented to an STD. Expeditiously see a specialist on the off chance that you have any genital side effects like an uncommon sore, a foul release, consuming when peeing, or seeping between periods. Get a test for chlamydia and gonorrhea consistently in the event that you are explicitly dynamic and more youthful than 25 years old. Have a genuine and open talk with your medical care supplier in the event that you are explicitly dynamic and find out if you ought to be tried for different STDs. Would PID be able to be relieved? Indeed, if PID is analyzed early, it very well may be dealt with. In any case, treatment will not fix any harm that has effectively happened to your regenerative framework. The more you hold on to get treated, the more probable it is that you will have confusion from PID. While taking antimicrobials, your side effects may disappear before the contamination is relieved. Regardless of whether side effects disappear, you should wrap up taking the entirety of your medication. Make certain to tell your new sex partners, so they can get tried and treated for STDs, as well. It is additionally vital that you and your accomplice both complete your treatment prior to having any sort of sex so you don't re-taint one another. You can get PID again in the event that you get contaminated with an STD once more. Likewise, in the event that you have had PID previously, you have a higher possibility of getting it once more. What occurs on the off chance that I don't get treated? Whenever analyzed and treated early, the entanglements of PID can be forestalled. A portion of the intricacies of PID is development of scar tissue both outside and inside the fallopian tubes that can prompt tubal blockage. Ectopic, pregnancy outside the belly. Barrenness, powerlessness to get pregnant. Long haul pelvic, stomach torment.